I've not been here before, and so far it's very interesting. I'm looking forward to being able to see a bit more of Jeddah after the conference.
And Professor Karen, and how did you find the conference schedule and the scientific content?
This conference has been very well organized. There are excellent speakers with high scientific content and very current and pertinent topics being discussed. I think the conference is an excellent conference.
Excellent. Professor Karen, what are you planning to give for the audience?
I think the important thing for the audience is hearing things in context. We can all read the journal articles, we can all go to meetings where new presentations are presented. Sometimes what people want to hear is the context. What do other people think about the data? How are they dealing with the data? How are they putting the data into their clinical practice? And what data is really important and what isn't?
Professor Karen, what are your message to the victims of breast cancer?
I think women and men who get breast cancer are doing better and better. I think it's a fearful thing, it's scary to get a diagnosis, but the majority of patients that we diagnose now with appropriate treatments are doing very well. So they don't have to be as victimized, they don't have to be as scary. Having said that, there still are too many people dying of breast cancer, and we have to do better. To do that, we have to do more and more research to understand which are those cancers that will recur, which are those bad cancers, which are those cancers that require really, really tough treatment. The other side is that we're understanding that many cancers don't need as much toxic treatment as we used to give. So understanding which cancers we can treat in a much more moderate way is important. The thing I would say to most women and men getting cancer is don't be fearful, keep your ears open, listen to what the oncologist says, and none of us can make predictions, we just have to be hopeful.
Excellent. Thank you, Professor Gilman. The last question is how do you see the future of breast cancer in terms of achievement in the breast cancer research and your expectation for the next 10 years?
I think in the next 10 years we're going to learn more and more and more about tiny little populations of breast cancer, many of which are the ones that do badly and recur. To do that, we need global cooperation. So meetings like this, where we meet people from other places, and where we possibly can even set up research collaborations are important. In order to do better with breast cancer, we have to understand the populations that do badly. We have to understand why they relapse, and then we have to develop new treatments to treat those women with those cancers. The final challenge will be how, in our local laboratories, can we set up services to just diagnose which of those cancers early on.
Thank you so much.
Thank you.